But this is a slide I use for GAIN, actually, to showcase where our work fits in the food system. But, food supply chains, a whole set of things around agricultural research and development, reducing food loss, reformulation, fortification, food environments. We heard a lot in the previous session about supporting small and medium enterprises that are supplying more nutritious food at lower prices that is more delicious to low-income consumers. There's a whole range of things we can do in the fiscal space about subsidizing the good, taxing the bad. Workforce nutrition programs, 1.5 billion people are in workforces every day. The workplace is a fantastic environment in which you can influence workers and employers. Clear food labeling. I was in Indonesia a couple of weeks ago. We were looking at some of the work we're doing, trialing clear food labels. No one can read the food labels, whether on the front of the pack or the back of the pack. No one can read them. I have 2.5 reading glasses. I still can't read them. I can't read them in reality, and if I can read them, even me, I can't actually understand many of them. So we need very simple, clear food labeling, preferably food labeling that bundles in health and environment. Under individual factors, there are all sorts of things we can do. Social protection programs scaled up rapidly in the COVID period, are still scaled, but too few of them are actually saying, what can we do to take advantage of this massive income infusion to change the production of nutritious food and change the consumption of nutritious food? The way we advertise, there was a lot of talk in the previous session about rebooting traditional neglected foods. How do you make foods that your grandmother, grandfather, parents sometimes loved, but now have fallen out of fashion? The public sector is pretty hopeless at doing this. We need some interesting ideas from the private sector to really link these foods to things that people care about. Not that many people actually care about nutrition. They really don't. But if you can find the thing they do care about and link it to nutrition, then you have a winner. Consumer behavior, we heard a lot about schools. School feeding is great. I grew up on free school meals in the UK. I can't vouch for their quality of their nutrition, but they were very important. They keep kids in school, they get kids to school, they keep kids alert in school. But it's a much bigger opportunity to teach children about food. Where does it come from? Why is it important? How to prepare it, how to store it, the impacts on the environment, all of that stuff, how it can generate a livelihood. That's such an important opportunity. So the school feeding is the way into a much bigger envelope of influence. And then a lot of technology. There's a ton of technology out there that can make it easier for consumers to purchase healthy food. So there's lots of options. I think data, when there are so many options, if I was a policymaker in Malawi or Ethiopia or Mozambique or Nigeria, I think I'd find it really hard to figure out where to start. What does my food system even look like? How do I diagnose it? And what do I do to fix it? Obviously, that's not just a technical process, it's a political process, and it's a capacity process. But I don't really have the data. So this is a mini plug for the food system dashboard that GAIN and FAO and Johns Hopkins and many other partners have put together with support from partners like Rockefeller and others. And I think it's probably the best source of food system data. That's on top right, that's the URL. If you would like to go to that, you'll see it in action. It pulls together data for 200, more than 200 indicators across the food system for 193 countries. It does three things. It describes the food system, it diagnoses it, and it links it to action. And this is an example of the diagnose work that's just happened. We look at 39 of those 200 indicators, and this is the data for Africa. So the rows are African countries, the columns are the indicators. And we've developed cutoffs. For green is obviously things are going pretty well. Red is things are pretty challenging, and orange is somewhere in the middle. And at a continental level, this doesn't really make much sense, but at a sub-regional and a country level, this is quite a good diagnostic. So you can see here, for example, in this middle, in the middle section, you can see most of the reds are in the nutrition outcomes. There are some reds in the supply chain, but not too many reds in the environmental outcomes. Yesterday I showed this picture for Europe, and Europe was much better in the supply chain, not so great in the nutrition, not so great in the food environment, but terrible in the environmental outcomes. So every continent has its own challenges with food systems. It's also, thanks to the work of Corinna Hawkes, is in the audience today, we've also been able to link these diagnoses to a set of actions that are a good starting point, at least, for policymakers to think about what they could do. These are policies that have been tried and tested elsewhere. They've been evaluated and shown to work. I think the real value actually of data, though, in food systems, whether it's in the food system dashboard or elsewhere, is the subnational. And we are working with governments of Nigeria, Tanzania, and Kenya to develop subnational dashboards. And this work is ongoing. The Nigeria work will be at the state level. So we'll have those diagnosis pictures for states in Nigeria, and that will be linked then to action. And I think that's going to be really dramatic. So my conclusions, I don't need to tell this crowd, food systems are terrible for health, they're terrible for the environment, they need to be transformed. And this is one thing that from talking to Corinna and others, there's no one thing that needs to happen. I'm often asked, what's the one thing that needs to happen to change food systems? And my answer is, stop asking that. That's the capacity to do them all at the same time, but you need to survey them all to figure out what you're going to start with. And I think final point is that we all know government cannot do this on its own. This is all of society have to happen. It's the lead, and government has to be braver. Governments have to, and this is not space, this is governments have to set the tone. Doing the kinds of things that the Rwanda government is doing. Food that is nutritious for your schools. Food that is nutritious for your safety net programs. Design your agricultural R&D so that it's all loaded into cereals. It's loaded into vegetables, fruit, and pulses. These are the no regrets, no that need to happen to transform food systems to make them good for the planet and good for people. Thank you.
Thank you very much, Lawrence. Please have a seat. So we are now going to move into our first panel. And the idea here is to listen to people that are actually doing work, different stakeholders. What are they doing to try and address all these challenges that Lawrence has outlined for us? And for the panel, I would like to first call upon Honorable Minister Ahmed Matobe Nuno, if he is in the room. I didn't see him earlier. Okay, and then the other panelists are Ms. Rahmat Ayefunjoyo, who is co-CEO of Nourishing Africa. If you can come forward, please. And then Ms. Adesuwa Ifedi, Senior Vice President of Africa Programs at Heifer International. And then Ms. Seinabu Dieng, CEO of Maya Enterprises. Mr. Roy Steiner, Senior Vice President, Rockefeller Foundation. And online, we are supposed to have Ms. Lynette Newfield, Director of Food and Nutrition Division at FAO. Welcome, Lynette. Now, you are all representing different stakeholders. Stakeholders who should really be responding to make our food systems work better. So I want to start with you, Ms. Rahmat. As you work as CEO for Nourishing Africa, I went and had a look at your LinkedIn page. And what I found there is that you state your goal as scaling up millions of agri-foods SMEs across Africa. And so how can we ensure that the SMEs on this continent deliver better diets and nutrition, that they do not simply copy what has gone wrong in the global north, and that we can begin to produce products that do not have too much fat, not too much sugar, watch the portion sizes. What are you doing to help us on that front in transforming our food systems? Over to you, Ms. Rahmat.
Thank you so much for the question. And I am absolutely delighted that we're starting with agri-SMEs, who are so critical for our food systems and nutrition. But first, I would like to say it's a pleasure to be here and a real honor, especially to represent agri-SMEs, Nourishing Africa. We're now African food change makers. It's a recent change, so I don't expect it's popular yet. But we are a platform for agri-SMEs, and what we do is to support them to scale resilient, profitable, and sustainable businesses. And first, I think it's really important to highlight the critical role that agri-food businesses do in our ecosystem, especially when it comes to nutrition, right? So these are the logistics providers, the input providers, the farmers, they provide extension services, they help move food from farm to fork. They're in between every activity that happens that takes food to our table. And when we begin to realize the context in which these agri-food businesses play, we begin to see how much they contribute to the nutritional value that comes to our table and to our stomachs. That being said, I would also want to refer to the theme of this 2022 AGRF, Grow, Nourish, and Reward. And I would speak to two of these, given that we're already speaking about nutrition and nourishment. So the first thing we do at Nourishing Africa is to recognize the important value that agri-food businesses bring to the table, bring to nutrition. And this actually informs the curriculum through which we engage these agribusinesses. And it is super important for all stakeholders to understand that when it comes to engaging agri-food businesses who are chefs and processors and are involved in the entire food production processing and bringing it to our table, we then think about how we can train them to become more sensitized and aware about the nutritional value of food. Because we see a lot of SMEs. Dr. Lawrence had mentioned earlier, he said, quite frankly, not everybody is interested in nutrition. And that is really true for agri-SMEs as well. And when we bring the business case of nutrition to them, it is so much more important for agri-SMEs to understand that nutrition can actually bring a good business case for them, profitable business case for them, and they can actually scale businesses that are profitable when they look at nutrition as a core focus. And in that sense, that's where I bring in the grow. When we think about ways in which we can help agri-SMEs to grow resilient, profitable businesses by showing them a clear business case that allows them to also incorporate nutritional aspects into their business models. The second part is the reward aspect.
If you can try and
yes.
Wrap up so that we can hear from the others as well, please. Thank you.
I think there's a lot more that can be done in terms of motivating and incentivizing agri-SMEs who are involved in the nutritional space. So we've seen how motivated we all were when the women entrepreneurs were celebrated and awarded, and I think this needs to go beyond, regional and national levels up to the global platforms to ensure that agri-SMEs actually are recognized for their work in nutrition. And this is one core work we do at Nourishing Africa as well. Thank you.
Thank you very much. So the key message I take is that we mustn't forget the SMEs and the role that they should play in our broader food system. So I'd like to move on to Ms. Adesua Ifedi, who's the president of Heifer International. And ma'am, to you, I realize that Heifer International's mission is to end hunger and poverty, but in a sustainable way. How do you incorporate sustainability in the programs that you are running at Heifer International? Over to you.
All right, thank you very much. So my name is Adesua Ifedi. I'm the Senior Vice President for Heifer's work in Africa. And we have worked across the world for over 75 years, and in Africa for over 45 years. Our organization was actually set up with the idea to end hunger and poverty, and we looked at countries that were war-torn, and the idea was to provide nutrition to the people in those countries. And what we started doing at the beginning of our foundation as an organization was really to ship out milk and healthy products to people who were war-torn and were malnourished. But over time we began to realize that your family does not need milk, what they need is a cow. And what it simply means is that we began to understand that as you look at the whole ecosystem that will support a sustainable growth and integration of nutrition and ending hunger, the participation of the household, the participation of the community, and also the understanding of the fact that there is also existing wisdom and knowledge which can also be harnessed from the power of what they know as well. So we began to think about how do we therefore support this ecosystem to lean on its own wisdom and grow what it needs in a sustainable way. So we began to do what we call the animal placement and passing on the gift, because we believed in the fact that if a family is given the assets, skills, and knowledge that it requires to not only feed itself and end hunger, it can also do that and also sustainably grow its income. But in addition, we also believe that power of the individual who is on the receiving end of this investment is also key, because that same individual can translate that knowledge to others in their community and build a critical mass of people who understand the importance of what needs to be done. And when I think to today, fast forward 75 years later, I don't think much has really changed. Listening to Nourish Africa, I think one thing we have to, as we consider sustainability, is the power of what exists already in the communities where we work, and the understanding that you cannot separate sustainable income generation for households and families to sustainable nutrition. Data already shows that there's a correlation between poverty and malnutrition. And so as we think about solutions to address family nutrition in a sustainable way, building the ecosystem that supports the value chains like the entrepreneurs and the food processors and the households that grow this food is critical. So starting at the community level, one of the things we believe in is empowering the women at the community level who are part of the community circles and groups to understand the nutritional value, to provide that same training and skills to their community and to their neighbors. And this morning we heard about the importance of women driving this kinds of initiative. And therefore they translate it at that level. But the next level, when we talk about scale, goes beyond just the production within the household, in the rural community, to the processors who drive scale in taking these products and getting them out to the market. We must start at that level, because actually 60 to 70% of the food being consumed are not being consumed from supermarkets, they are consumed from local production. And so if there is an incentive to drive local processors to look at the nutritional value and the health value and to focus on organic, that in itself will trigger a much more sustainable and scalable solution to that. So how do we incentivize programs that reward processors who think about nutrition.
Okay.
And
Thank
so
you
for
very
us in
much.
HEFA, these are the two ways that we have broadened our work, starting at the community level and now going to work across farm to market.
Yeah. So what I really like about your efforts is the fact that if we look across the African continent, we still get quite a bit of our food from the informal food processing that actually takes place. So paying attention to that should actually be part of our efforts if we are to transform food systems, within the context of where our population gets their food from. I want to move on to, is it Ms. Seinabu or?
Yes.
Yes, from CEO from Maya Enterprises, you will see that so far we've been paying attention to private sector. It was a deliberate effort to start there first. And so in your case, what does Maya Enterprises do and what challenges must be addressed so that Maya Enterprises and other entities like yourselves can actually do better to contribute to better diets? Yes. Over to you.
Thank you so much for this great opportunity. I'm very happy to be here. So my name is Seinabu Dieng. I'm the CEO and the founder of Maya. Our mission is to reconnect the African farmers with the market, but for that we need to give value to their products to make them more beautiful, because packaging is a great issue, is a reason why when many people continue to consume imported food, we need also to make sure that it's healthy and that is easy to use, because people don't have time our mothers have in the back. So I used to take my mother's hibiscus juice to school when I was younger. I used to eat her millet pancakes. But now, those products you cannot find because women don't have time in urban cities to cook anymore. So this is what we are trying to tackle. Like my sister said earlier very nicely, so far we have a lot of projects helping big companies and big factories to do food fortifications. Unfortunately, smaller companies doesn't benefit for that, and we are more in terms of people and impact, but we are less in terms of visibility. So we need to reconsider that point if we want people to eat healthier diets. The other point for me is that healthy diet is not affordable. So we need to think of new ways and new business models to make sure that everyone can afford it. One business model that I really loved is one of my fellow entrepreneurs from Asia. She has a company, a catering company actually, and she managed to have a buy one, give one project. So corporate people, they come and buy food from her, and she delivers one free meal to underserved children that cannot eat or buy healthy food. So those kind of things we can do, for example, in Africa for the school system, for example, by raising corporate social responsibility funds from big corporations. Instead of buying bags and stuff like that, they could just empower local enterprises by buying their food and distributing it to young children. Thank you.
Thank you very much. And I love where you have ended, because it allows me to move on to Dr. Roy Steiner very well, bringing on the issue of corporate responsibility, but also trying to make healthier diets more accessible to poorer sectors of the community. And so that brings me really nicely to you, Roy. As a funding organizations, how do your efforts fit into the idea of doing better to address diets and nutrition, not just, but sustainably? And also, specifically in Africa, have you identified interesting things to invest in to respond to what our colleague has just said now? Over to you.
Sure, thank you, Namokola. One of the innovations that we're really quite interested and excited by is something that increases food by 20 to 30%, nutrition by 5 times, and doesn't cost anything else. And you would probably know what that is, which is really shifting from refined grain to whole grain. Particularly, we're focusing on school meals. But when you take 100 kilograms of wheat or maize and you refine it, you only have about 70 kilograms of refined. But if you eat it as a whole grain, you have 98 kilograms. And if you fortify it, you get 5 times the nutrition. And it turns out that that's actually cheaper than refined grains. And the reason why we eat so much refined grain is that 30 years ago, whole grain had a very short shelf life, about 4 weeks. But now we have milling technologies that can make it 6 months plus. So the original reason for all the refinement no longer exists, but everybody's stuck in habits of consumption. And we need to go back to what we know is really the healthiest way of eating a grain. And we've been piloting this in Rwanda with school meals. We started with 4,000 kids, this year 50,000, and we're hoping 3.5 million children in the next year or two, and then scaling that across Africa. And literally, when you do that, suddenly you have 20 to 30% more food, 5 times more nutrition, and it doesn't cost the schools anything more, and millers make more money. There's almost no intervention that I know of that has those combinations of win, 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 win. So that's the thing I think I wanted to just share. If this is an area of interest, we're very excited. It just requires a little bit of change in the milling with the millers, but other than that, it's a bit of behavior change, and it can be done.
Thank you very much. I also like the fact that you are using that for school feeding, because then our children will grow up loving whole grain meals as opposed to the refined stuff that we are now consuming. That takes me nicely to Dr. Lynette Newfield online, Director of Food and Nutrition at FAO. Lynette, the African continent needs to address different forms of malnutrition. We've been told this morning and throughout this event that we are facing not only undernutrition, but also overweight, obesity, and related problems. As a technical guru in this area of food and nutrition, what are you missing? And especially, how can we accelerate change in spite of all the challenges that we are currently facing? Over to you. We can't hear her. Can you maybe check if you are muted, perhaps?
Hello?
Okay, we can hear you now.
You can hear me now? Okay. Thank you very much, and I'm very sorry that I'm not there with you in person. I would really like to make 3 points. First of all, the fact that the centrality of healthy diets for all forms of malnutrition is really a game changer in the field of nutrition. For so long, we've focused on individual problems and short-term solutions in a treatment focus on nutrition, and this shift towards focusing on healthy diets is fundamental, and its time has really come. But there's a lot we need to do to address that and to move forward collectively making those changes. First of all, I'd like to highlight that while we have a set of common principles that define a healthy diet, there isn't only one dietary pattern which is consistent with a healthy diet. And unfortunately, along with all of the attention that healthy diets are now getting, there's a lot of information in the public space, but there's also a lot of disinformation in the public space, and we need to be careful with that. In countries, the way to get ahead of this is through food-based dietary guidelines. They consider local patterns of food consumption, traditions, local production and food availability, and should form the foundation of policies and programs to promote healthy diets and agriculture, and etc., to ensure that the foods that form that healthy diet in context are available and affordable. But since 2000, only 9 African countries have developed food-based dietary guidelines, most recently Gabon and Ethiopia. This is a critical gap, and it's an easily addressed gap. It is not, it's a bit of a long process, but it's not difficult to develop food-based dietary guidelines, and it's really critically important. There is no one single pattern that is healthy, and I can't overemphasize that enough. So that would be my first point, and this fall, earlier or later this year, FAO will be publishing a new manual for the development of food-based dietary guidelines that includes sustainability considerations in production, which is a critical update and factor as well. Related to this, we've heard the importance of data already, but again, only a few countries in Africa have recent dietary intake data. It characterizes what people eat, and this is particularly true for some sets of the population. Earlier this year, we published a paper in Lancet about dietary intake and determinants of dietary intake among adolescents, and unfortunately, Africa was the region of the world with the least data available on what adolescents eat and why they choose the foods that they do. We heard from Lawrence that food is medicine, but what we learned in that paper when speaking to adolescents about why they eat what they eat is that they rarely identify health as a consideration in their food choice. Food is tradition, it's pleasure, it's social factors, it's social engagement, social interaction, and one of the considerations that they mentioned frequently across many contexts was value for money in the choices that they made. We must engage with people, and particularly with adolescents, to find ways to motivate them to make changes. It's such a fundamental period of life for establishing healthy dietary patterns, and we can't overemphasize that enough. And
Dès le plus jeune âge. Et enfin, je souhaiterais rebondir sur un point qui a été mis en avant par
food systems and the health of our environment as well as health of people. And there's a couple of points to raise in that regard. First of all, there are inevitably going to be trade-offs in balancing human and planetary health with regards to food production, and we shouldn't be afraid to highlight those, generate the evidence we need to understand them and to overcome them. But there's also many win-wins that we should be building on, and we should do those without delay. One of them obviously is biodiversity. We've heard already about underutilized crops, neglected foods, bringing back some of the healthy food traditions that have been lost in so many contexts. And we've also heard about the role of SMEs and the importance of school feeding, and there is some really great examples in Africa of linking local production with school feeding programs, which is truly a win-win. But it needs guidance, it needs policies, and it needs that system to be built up and expanded so that those programs can reach many, many more children in that critical phase of life. And I think I'll leave it at that in the interest of time. Thanks.
Yeah, thank you very much, Lynette. Really, you've touched on multiple things that we can actually look to for solutions as we look to transform our food systems. Now, we're rushing in time because we have another group that we would like to just make their statements as well. But Lawrence, I want to finish off with you. Based on what you have heard, what would be one key message that you would give the panelists here against the data you were presenting to us? What should they look out for if we are to move our transformation to the next level to do better for the continent?
Thanks, Amakola. I didn't know you were going to ask me that, so that's a good question. I was a bit disturbed by a point somebody made, I think in the previous session, it may have been yesterday. Someone said policy doesn't matter. I just think that's completely wrong. there's so many policies that are written down that never get implemented. Yeah, that's a big disconnect. But if policies can get implemented, they can make a big impact. So I pick up on a couple of the examples here. For Ramat, some of the examples you gave us about SMEs, policies really matter. We have some work in Nigeria where SMEs are trying to be innovative and develop portable cooling units that can go from farm to farm and aggregate and then get that to wholesalers who can then get it to the market. The insulation material, because they use reconverted trade containers, this is in Nigeria, the insulation material they use is imported because it can't be produced in Nigeria, and it's taxed. There's a big tariff on the imported insulation material. That's an example of a concrete policy change that can really help SMEs that are trying to keep food from spoiling and keep it fresh. Another example on policy is in Kenya. We were working with one of our Kenyan SMEs, and they were doing all this innovative stuff, and we said, why don't you patent this innovation? And they said, it's not worth it. We said, why is it not worth it? They said, it costs way too much. So I went back and looked at the evidence, and it turns out that it costs 20 times the national income, the average income, to get something patented in Kenya. In the US, it costs about a quarter of someone's income to get it patented. So again, here's a policy decision about how easy it is to get something patented in a country that makes a huge difference to SMEs and others who are trying to innovate and do things. So policy matters. It has to be implemented. It has to be the right policy. It has to be guided by health concerns and sustainability concerns, but it matters.
So thank you very much. Policies to support the efforts that are going on in the private sector, but also policies that also encourage sustainability as part of what we do. Thank you very much to the panelists. You may step down. I'm going to call in the meantime the next group. Very quickly, for the next panel, we start with Dr. Francesca Branca, who is Director of the Department of Nutrition for Health and Development at WHO. The next is Dr. Klaus Kramer, Managing Director, Sight and Life Foundation. Dr. Abdu Tukwamo, Executive Director of CORAF, is not here with us, but I wonder if I can ask Michael, because he sent his statement. Michael, Victor, if you can join the group on stage so that you can provide that statement to us, please. Then Ms. Edith Haynes, WFP Country Director to Rwanda. And then Prof. Corina Hawkes, Director, Center for Food Policy, City University, London. And then Mr. Paul Newman, who is Coordinator of SDG2 Advocacy Hub. Thank you very much to the panelists. And we follow on at great neck speed. We are now holding lunch, as you can see. Starting first with you, Dr. Francesca Branca. You are at WHO, and we know nutrition and health are important outcomes of sustainable food systems. On linking food systems to diets, how much trouble are we in on the African continent? And where do you see hope in terms of us making a meaningful change given the food systems challenges that we are now facing?
Well, thanks, Namukolo. I think, as you probably have gathered also from the rest of the session, food systems do not prioritize health. It's a global problem. You know, we have over 800 million people who are food insecure. We have people dying every year because of maternal and child malnutrition, because of obesity, because of unhealthy diet. And that is about 1/3 of total mortality. It's about 15 million people every year. It's twice the COVID pandemic, more than twice the COVID pandemic every year. So it's a big deal. In Africa, what we have seen is that, we have major crises. We have the Sahel crisis, so we have a Horn of Africa crisis. We see stunting decreasing at a very slow pace, and we have seen obesity picking up in many countries. So we really have a double burden of malnutrition, which is giving a big stress to health systems. And then the diet. The diet is changing, but it's not necessarily changing for the better, because it's changing towards the consumption of food which are more highly processed, higher in fat, sugar, and salt. So is there hope? I think there is hope. We saw at the Food System Summit 33 countries making a high-level political commitment and developing a food transformation pathway. At the World Health Assembly, we had 10 countries in Africa who have decided to become the front runner for the acceleration plan on obesity. So something is happening. WHO is calling for the implementation of 6 policies. You've heard some of them. 1, public food procurement, healthcare public food procurement. 2, curbing marketing of unhealthy food to children. 3, clear front of the pack labeling, nutrition front of the pack labeling. 4, changing the design of the food to food reformulation. 5, fortification of food. 6, price policies to make the unhealthy food more expensive. WHO is going to work countries and work with intergovernmental dialogues and supporting the implementation of these actions.
Thank you very much. Indeed, I think we usually overlook just how costly malnutrition is to countries. Now, we have a continent where we still have a relatively rich food biodiversity. And so I had asked Dr. Abdou Tukwamo, whom you are representing, Michael, I can see you're looking at your phone. What I asked him was, if we look at the fact that the African continent has a rich food biodiversity, unfortunately, this is also diversity that we are losing. We just not paying enough attention to it. So what I'd asked him was, for someone with extensive plant breeding experience, how did he feel we could harness the food biodiversity of the continent so that we can go beyond maize, rice, and wheat to increase production diversity that can serve for better diet and nutrition on the continent? So what is he saying to us? Over to you, Michael.
Okay. Thank you, Namakulo. And I'm not a plant breeder nor Dr. Abdou, but I'll try to represent his words. But I do think listening to the panel discussion today and the rest of the many of the sessions, his point about food diversity and really finding the local foods is really important. So, Your Excellencies, distinguished ladies and gentlemen, Africa is known for its rich biodiversity, yet it's also known to be home, sadly, to high prevalence of hunger and malnutrition. Perhaps this is the way to encapsulate Africa's situation by using the phrase scarcity amidst abundance. What we observe throughout Africa is the paradox that the production basins that feed the rest of the country are also those with high prevalence of malnutrition. This often is affecting children and women of childbearing age, while the cities to which the production goes are home to high levels of disease related to insufficient dietary diversity. So uncoupling production and consumption may be the cause, but regardless, what can we do before it is too late? Nutrient-rich crops that can be grown along with cash crops should be encouraged. This will increase the land equivalent ratio in every respect. Traditional leafy or fruit vegetables are such nutrient-dense crops that can easily be cultivated with the main crops. Likewise, raising poultry or small ruminants as a companion activity could provide much-needed source of animal proteins as well as livelihood opportunities. One approach that was used in Mali was to set up community gardens managed by women using research-proven technologies and know-how to grow diversity of vegetables in sufficient quantity all year round. The technological aspects were less important than the social construct of bringing the women together to learn by doing and to use the produce to feed their children while processing the excess for sale. The gardens became teaching grounds for schools and suppliers of school feeding canteens. In short, diversity at the table can be enhanced by diversity in the field. Using our native crops such as millets and leafy vegetables, diversity in the field could be augmented with biofortified varieties. Diversity at the table can be increased with nutrient-preserving cooking, and if this approach is used, then the dietary supplementation can be used for only for critical states of malnutrition.
Okay, thank you very much. So essentially, greater production diversity, but leveraging the biodiversity that we already have. That brings me to Dr. Klaus Kramer, Managing Director, Sight and Life Foundation. Klaus, I have noticed that recently Sight and Life is paying much attention to egg production. Why have you identified this as an area that deserves your effort?
Yeah, thank you, Namokolo. Indeed, in the past, we were focusing primarily on micronutrient fortification and supplementation, but micronutrients are not sufficient to improve diets, so we need more diversity. And in own research, we found that stunted children from Malawi did have low levels of essential amino acids, low levels of choline, which is a B vitamin, and long-chain fatty acids. And then we thought these are all nutrients very dense in eggs, in addition to vitamins and minerals. And indeed, there were some studies showing that eggs can reduce stunting in young children. In addition to a very recent study in India, where school-going children benefited from an egg and improved their weight. And we found in our value chain analysis in sub-Saharan Africa that eggs are scarce and expensive. The availability of eggs per capita and year is less than 25. And in Rwanda, I found the number is less than 13. And when we go to Germany, we have almost 250 eggs per capita, in the US almost 300 eggs. So we need to think about the value chain on how to make eggs more available, affordable, and accessible. And I would also add, listening to here, more aspirational and actionable. And for that reason, we developed a new business model, social business model. We call it the Egg Hub. It's a market-based approach to make more eggs available. But we also found that in this business model, we can move into the rural area. And the critical issue is with this business model that we have an entrepreneur who's supplying all the inputs to smallholder farmers in rural areas with the hens, with the feed, but with the housing condition, credit, and also the training and technical assistance. But at the same time, when we want to improve nutrition among vulnerable groups, we have to consider that eggs are frequently consumed by the man in the family or the visitor. And for that reason, we initiated after market research, social marketing to specifically catering to children and to their mothers. What we have now, we have egg hubs evaluated in 3 countries, Malawi, Peru, and Brazil, and are now starting a new endeavor in Ethiopia, setting up 225 farms in Ethiopia to produce 11 million eggs. And right now we produce 18 million eggs in these 3 countries I mentioned before. But one critical aspect is, I'm just coming to the end, we need more entrepreneurs. as we heard today, in the agro-food business. And for that reason, we have started to partner with the Harvard Business School and do a distant training on entrepreneurship. And I would really encourage women entrepreneurs to enroll and come to our booth. There are also fellowships available to support you.
So I just want to encourage people in the audience that if you want to get more information about any of the panelists, please do feel free, just look them up on social media and follow them. Or you've got my name, you can reach out to me and I will pass your messages on, because I realize we want to have time for people to ask questions that they might want to ask. Edith, coming to you as WFP Country Director to Rwanda, increasing sustainable access to better diets and nutrition is one of the areas that the AU Year of Nutrition is targeting. Associated with promoting better nutrition, school feeding has been a significant area of focus for WFP for many years. What are the shortcomings currently being faced by African countries regarding successful and accessible school feeding systems, in your opinion? Over to you.
Thank you. And indeed, school feeding has been mentioned so many times already this morning. And if you have a nutrition-sensitive school feeding program, that can actually provide access to nutrients for especially vulnerable communities. So an excellent safety net that can have a great nutritional value. And so we have seen, we're still in COVID, I hope we're getting to the end of the pandemic, but COVID has had a tremendous impact on health, on nutrition, on education. And while children are getting back to school now, what we see is that very often for school feeding, a problem is insufficient and unpredictable budgets for school feeding. And that's really an impediment to being able to access healthy diets. And of course, with the current food price crisis, that situation got even worse. If you look at Africa, on the positive side, Africa is actually, or countries are actually proven leaders in school feeding. If you look at the situation between 2013 and 2019, there was an increase of 71% in the number of children receiving school meals on a daily basis. So it went from 38 million to 65 million children that are receiving school meals. And that was mostly thanks to national budgets that were made available by these countries for school feeding specifically. But despite this, there are still very big inequalities and discrepancies. And we see in high-income countries that 80% of the children are getting a school meal. If we look at low-income countries, it's only 20%. And also in Africa, there's still 60 million children from low-income families below the poverty line that don't have access to that school meal. And to tackle that, more than 70 countries actually came together and they launched the School Meals Coalition, which was launched during the Food Systems Summit. And there's more than 30 African countries in that coalition as well. And the whole goal of that coalition is to come together as countries to support each other, to scale up, develop high-quality school meals programs. And Rwanda is one of the members as well. And the main goal of this coalition is to transition to self-reliance and to national ownership of these programs. And all the ingredients for success are there with strong leadership and political will. So here in Rwanda, WFP has a dual role in school feeding. We're both providing technical assistance to the governments, and the government started their national school feeding program last year, but we have also been implementing a school feeding program for pre-primary and primary children over a number of years. And the government of Rwanda has committed a budget to school feeding, and through that they have been scaling up from 600,000 children before the national program started to 3.3 million children to date. And I already mentioned they're part of the School Meals Coalition. At the moment they're very much focusing on a financing strategy with the support from other governments and research institutes that are working within the coalition as well. Just to finish, one last point. We see that what is needed is more investment and public-private partnership across the food system to enable those school feeding programs to reach their maximum potential and transform diets. And I'm going to give you two examples which are the case for Rwanda, but I'm sure for many other African countries as well. And what we see in those programs is limited availability of fortified foods, fortified flours at the local level, where here in Rwanda the schools are buying their food. So fortified flours, also whole grain, and our colleagues from the Rockefeller Foundation mentioned this earlier. We are actually working with the Rockefeller Foundation here in Rwanda to decentralize fortification of flours and to work with whole grains. We have already been piloting that in schools to provide healthier, affordable diets for the school feeding program.
So strong buy-in in school feeding already on the African continent, but requiring more investment for it to play its role in our food systems transformation process. That brings me nicely to Corinna. And Corinna is Director Center for Food Policy at City University London. Edith mentioned the School Meals Coalition, which I encourage the audience to really look up and see how you can engage there. But that brings me nicely to the question that I want to ask Corinna. You are one of the founding members of the Coalition of Action for Healthy Diets from Sustainable Food Systems for Children and All, which means school children too, I guess. How can this coalition make a difference on food systems transformation to get to better diets and nutrition from sustainable food systems for the African continent? Over to you.
Thank you, Namakolo. Yes, the Coalition on Healthy Diets and Sustainable Food Systems, we set it up as part of the UN Food Systems Summit process. And the initial motivation was because we needed to make sure that healthy diets were on the agenda and stayed on the agenda. What value can it add? When we hear about these fantastic actions that have been, we've heard about them all day, the wonderful actions that are being taken to try and advance healthy diets, to try and advance the sustainability.
Can you maybe get closer to the mic? I'm struggling to hear.
Oh, I'm sorry. There were so many actions that are being taken at the country level, at the local level, at the global level to advance healthy diets and to advance the sustainability of food systems. And there were also thousands, literally millions probably, of decisions that are made on a daily basis throughout the food system, which affect food consumption, food production, food retailing. And those decisions typically don't consider healthy diets. That point has been made. There's also a lot of decisions that are made at the household level about what to provide in the household, which are constrained by a lot of factors out there in food systems and beyond. So there's a lot of actions and a lot of decisions, and it's not aligned. It's not coordinated. It's not seen as a system of actions. It's seen as things that are being done by different players, by different people. Now, just imagine if those actions and those decisions were aligned towards the same purpose in the same direction. You would gain efficiencies in who is doing what, you would gain effectiveness and impact, and you would gain equity in terms of making sure that those actually had impact on the people who most need to benefit. So the purpose of the coalition was to stand back and provide leadership in encouraging what needs to happen at the national level and the local level, which is to stand back and say who needs to be involved, who is doing what, how can we coordinate, how can we work together towards the same shared vision that we all have. And that is missing at the moment. It's about providing global leadership for what needs to happen at the local and national level.
So thank you very much. So we've got a shared vision, UN Food Systems Summit has brought that to us. And we've heard earlier on the previous panel, different actions being taken by SMEs, by funding organizations and others. And we've heard again here a lot of efforts being made. And essentially what you are saying is all these efforts, can you imagine how much momentum we could build if it was aligned so that we can build some synergy? And so I think that is something for us to look at on the continent, on how do we align our efforts to ensure that we can build that collective momentum for stronger food systems transformation. Which takes me nicely to Paul Newman, Coordinator, SDG 2 Advocacy Hub. This is 2022, and I think the AU Year of Nutrition has really come because we've looked at, we only have 8 years more left to the 2030 agenda that we had set for ourselves. So after listening to all that has been said, what would be your ask to accelerate progress on SDG 2 towards better food security, better diets, and nutrition outcomes by the time we get to 2030? Because, you've heard what everybody is trying to do, but from your perspective, whose life is centered around advocating for us reaching our SDG 2 goals, what would you say to us as part of also closing today? Over to you.
Yeah, thank you. And it's been great to hear so many different actions and so many different approaches and really drive. We have a couple of frameworks. The African Union has named 2022 the Year of Nutrition, and this is a really important reminder for us to realize these connections between healthy diets and nutrition on one hand and sustainable agriculture on the other, to really create solutions that drive on multiple purposes. And the UN Food Systems Summit, as we've discussed, is also helped to really bring together conversations on this and frames. We have the SDGs, we also have the CADA, and they provide clear goals, they provide clear targets and tracking mechanisms to monitor progress. And so sometimes people say we don't have the goals. I think we kind of do. They might not be all perfect, but they are there, and we should be focusing and trying to drive forward because they help us to track many of the food security and diet-related elements. But I think what we need is cross-cutting solutions that really can affect multiple changes simultaneously. And I think this is something that has to happen. We've got lots of action, but we need to think about which actions are going to give us simultaneous change. And I think this is going to require governments, NGOs, civil society, private sector, and even more to come together to really share knowledge on best practice, create that innovative system-based approach to meaningful transformation. And I like what you were saying, Karina, about seeing it as a connected system to be able to really drive this, but it has to break down silos. And I actually often feel like we're creating more silos the more we go into this rather than actually connecting. And so we're having that conversation about a system, and we've accepted that. But now we need to live that. We need to actually think that way. And that requires a level of collaboration and cooperation. We have a global conflict, a debt crisis, the threat of worsening climate effects. And so it's absolutely vital that we identify triple wins in order to invest in local solutions that are good for people, planet, and prosperity. And I think we sometimes make choices on this front, and I think we have to think, if it doesn't deliver on that, why are we doing it? let's put the energy into something there that actually drives that forward so that we can recommit to these goals that we've set and move forward to achieve our nutrition and development goals. So I'm really hungry for coordinated action. I'm really keen to see that happen. Thank you.
Okay, thank you very much. I've lost my microphone. I think just to close, because we are rushing behind time.
Everyone's hungry for it.
Just to get to, we are now at the end, and I like where you have ended. We really have a lot that is going for us on the African continent. I think what we need to figure out is how do we harness all the activities that are going on to build positive momentum for positive food systems transformation that can deliver better diets and nutrition outcomes. In listening to the need for us to be able to align and to build that momentum and synergies, I think one area that might be missing in what we are investing in is how to get this alignment actually going across different stakeholders. And I think it is worth thinking of actually investing in that as well, so that we don't end up with droplets of efforts, but we can actually begin to see how the big picture fits together for the multiple efforts that we are making. So I want to thank the panelists, all of you. Thank you very much for your patience with the time constraints that we have faced. Thank you to the audience for sticking around and staying with us with our time constraints, and I trust the information will have been useful to you. I still would like to say I will look out on my, if you look at Namkolo C as a Twitter handle, you can send me a private message if you have questions you would have liked to have asked any of the panelists, and I will be happy to pass them on so that you can be able to get your answers. Thank you very much, everybody, and do have a good lunch. Thank you.
Thank you, Namokolo.